Pregnancy can be stressful, especially during a lockdown caused by a pandemic. So you can imagine the plight when you or someone close to you tests positive for the novel coronavirus. But exactly how serious is the impact of COVID-19 on pregnancy? Let's examine. Relatively speaking, pregnant women are not much of a high risk, as it was in the case of severe acute respiratory syndrome or SARS pandemic, back in 2003. During that time, pregnant women had a high risk of 25%, as compared to 10% for general population. The Lancet publication published a report based on 9 pregnant women from Wuhan, China, the epicenter of COVID-19 pandemic, who were treated for COVID-induced pneumonia. But none of the women well in their 3rd semester of pregnancy developed complex illnesses, and their babies were born healthy, without coronavirus. On February 28, 2020, the World Health Organization came out with a report that out of 147 pregnant women, of whom 64 were coronavirus positive, 82 were suspected to have the virus, and 1 without any symptoms. Only 8% of this group developed severe symptoms and 1% became a serious condition. The World Health Organization has stated that there is research underway to understand how COVID-19 will impact pregnant women. The evidence on hand doesn't show them as any higher risk than the general population. Having said that, pregnant women have to take utmost care than ever, because their immunity system weakens during pregnancy, making them vulnerable to infections and diseases, which also includes COVID-19. So, it is important to have iron-rich and immunity-boosting foods like vegetables, fruits and nuts. You can also take vitamin supplements after checking with your doctor. One doesn't have to really say this, because it has been stated again and again, but avoid going to crowded places. Practice social distancing and stay at home. Stay away from people who are ill. Wash your hands regularly with a good hand wash or soap for 20 seconds. Avoid touching your face, and wear a mask, if at all, you have to go outside. Since there is a risk of infection from hospitals, opt for telemedicine facilities from your doctor. Visit the hospital only if it is very important or if checkups are a must. Should pregnant women be tested for COVID-19? The World Health Organization says that pregnant women with symptoms of COVID-19 should be prioritized for testing. Do not self-medicate. Always let your doctor know if you have symptoms like fever, headache, diarrhea or even loss of smell. If you have been in contact with someone who has had COVID-19, bring it to the notice of your medical practitioner. Due to the much-needed restrictions, hospitals will not allow more than 1 visitor during the delivery, so you have to be mentally prepared for that. What if you have tested positive for COVID-19 while being pregnant, or just before delivery? Can the baby be breastfed? The CDC says, in limited studies on women with COVID-19, the virus has not been detected in breast milk. However, we do not know whether mothers with COVID-19 can transmit the virus via breast milk. The World Health Organization has stated the virus has not been detected in breast milk or amniotic fluid. The new mother should check with her doctor if she should start or continue breastfeeding. She has to take all possible precautions to prevent spreading the virus to the infant. This includes washing hands every time before touching the baby, wearing a mask to cover nose and mouth while breastfeeding, and cleaning and disinfecting surfaces that they have touched. If the breast milk is expressed with a manual or electric breast pump, the mother should wash her hands properly before touching the pump or parts of the bottle. If you have been tested positive for COVID-19 and delivered a baby, the doctor will usually isolate the baby, who will be looked after by healthcare experts, wearing protective gear. We have included a CDC link below in the description that shows how to clean the pump after every use. If the mother is symptomatic, she should ask someone who is healthy to feed the expressed breast milk to the baby. If you found this video helpful, please hit the like button and share it with your friends. Do not forget to subscribe to our channel, Health Destination. Stay tuned for more videos in our series, Let's Beat COVID-19. Press the bell button near the subscribe button so that you get to see our new videos first.